Assalamualaikum and hi everyone. My name is Muhammad Iskandar Zulkarnain bin Azmi and I am the director of the Healthdemic Incorporated. For those who doesn't know, Healthdemic is a healthcare organization that is dedicated to provide more compassionate care to our patients. So for today's episode, me and my mates are going to share you about the depression called Postpartum Depression. So without further ado, let's get started. But before that, please don't forget to like, share and subscribe. Postpartum depression, or its short form PPD, is a complex mix of physical, emotional, and behavioral changes that happen in some women after giving birth. According to the DSM-5, which is a manual used to diagnose mental disorders, PPD is a form of major depression that begins within 4 weeks after delivery. The diagnosis of PPD is based on not only the length of time between delivery onset, but on the severity of the depression. PPD is linked to chemical, social, and psychological changes that happen when having a baby. The term describes a range of physical and emotional changes that many new mothers experience. PPD can be treated with medication and counseling. So, basically there are 3 types of PPD. Number 1 is postpartum blues, better known as baby blues. This condition is affect between 50 to 75% women after delivery. If you are experiencing this baby blues, you will have frequent prolonged bouts of crying for no apparent reason, sadness and anxiety. The condition usually begins in the first week after delivery. Although the experience is very unpleasant, the condition usually subsides within 2 weeks or without treatment. All you need is reassurance and help with the baby and household chores. Secondly, postpartum depression. This is an extremely severe form of postpartum depression and requires emergency medical attention. This condition is relatively rare, affecting only 1 in 10 in new mothers. If you have PPD before, your risk increases to 30%. You may have experienced alternating highs and lows, frequent crying, irritability, and fatigue, as well as feeling guilt, anxiety, and inability to care for your baby or yourself. Symptoms range from mild to severe and may appear within days of delivery or gradually even up to a year later. Although symptoms can last from several weeks up to a year, treatment with psychotherapy or antidepressants is very effective. Alright, last but not least is postpartum psychosis. This is an extremely severe form of postpartum depression and requires medical attention. This condition is relatively rare, affecting only 1 in 1,000 women after delivery. The symptoms generally occur quickly after delivery and are very severe, lasting for a few weeks to several months. Symptoms include severe agitation, confusion, feelings of hopelessness, shame, insomnia, paranoia, delusion or hallucinations, hyperactivity, or rapid speech. Postpartum psychosis requires immediate medical attention since there are increased risk of suicide and risk to the harm of the baby. Treatment will usually include admission to the hospital for mother and medicine. Thank you.
Hi, my name is Amirul Muminin bin Muhammad Robi. Today, I want to show you about signs and symptoms of postpartum depression. Alright, let me introduce you. The symptoms of postpartum depression are similar. The symptoms are depressive episode, feeling sad most of the day for more days that not change, is appetite and sleep. Loss of energy, not enjoying things one did previously, feeling restless, ashamed or guilty, feeling hopeless, restlessness, thought of suicide, and difficulty concentrating and making decisions. In addition, and specific to PPD, other symptoms include difficult bonding with the baby, excessive crying, excessive fear of not being a good mother, and extreme situation, thought of the harming the baby. Alright. Are there early warning signs of postpartum depression? It's quite normal to have a slight drop in mood within the first week or two after having a baby. That's because your body has gone through a lot of change, physical and hormonal, within a short amount of time. Your body will generally start to regulate itself after a couple of weeks, and what some people call the baby blues should subside about the same times. So this is the symptom of postpartum depression affect your quality of life and include feeling sad or down often, frequent crying and tearfulness, loss of interest and pleasure in life, loss of appetite, loss energy and motivation to do things, difficult sleepy, including trouble falling asleep, trouble staying asleep, or sleeping more than usual, feeling restless, helpless or guilty, explained weight loss and gain, showing little interest in your baby, not feeling attached to your baby. So, this is the symptom and sign of postpartum depression. Thank you.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. So for today, I will be brief and explain to you about what are the causes of postpartum depression. So, the first one is bodily changes. What is by this mean is there will be sharp drop in hormones. So what are the hormones involved is estrogen, progesterone and thyroid hormones. So next, how can we differentiate between anxiety or having a bad day? So basically there is a slight difference between anxiety or having bad day in the term of postpartum depression. It also called by baby blues. So how can we interact with it? First, we can identify by the overwhelmed feelings. Next is the mood swings, and then is they are having difficulty in sleeping. After that, there will be a lot of crying in their first week or in their life in having a newborn, and then they also have difficulty bonding with the newborn, and last but not least is loss of appetite. So these are the symptoms or the things that we call baby blues. So if you have this thing or your wife have these things, it is normal, but if it is more than 2 weeks, so it will become for postpartum depression. So next is when will be the symptom show up. So basically after the moms get home in the first few weeks, they will get all of the feelings and all of the characteristic that I have stated before. After that, when they are dealing with chores, then the emotion while they are tired. So what will be this mean is their anxiety will exacerbate through the postpartum depression. So in this era of the pandemic of coronavirus, so the rate of the mothers to have postpartum depression is increasing tenfold. So next, does postpartum depression need to be handled alone? For my opinion, it's not. First, what you can do is you need the support from the family and seek for professionals. Then you need someone to talk to, and then you need to regularly check the hormones levels. So how can we fight this postpartum depression? In my opinion, or in our group of Healthdemic, we offered to you guys the good website which has a lot of great resources. Also, all of the mothers, all of the new mothers will have access to licensed professional counselors. Then in this world also have the Postpartum Support International. They also have good resources and virtual supports, so they could interact virtually with all of the mothers around the world. Lastly, they have the perinatal psychologists, so they are specialized in moms dealing with postpartum depression. They will help you to get through these things, so we could fight together and we to have a better life. So that's all from me. Thank you.
Okay, Assalamualaikum and hi to everyone. I'm Firdaus. Right now, I would like to explain to all of you about risk factor of postpartum and depression. So, any new mom can experience postpartum depression and it can be developed after the birth of any child, not just the first. However, your risk increase if you have a history of depression either during pregnancy or at other times, age at the time of pregnancy, number of children, family history, marital conflict. So this is point I would like to explain to all of you. So if you have a history of depression either during a pregnancy or other time, so this thing is like before this, pregnant mother has experienced depression with her life and can increase the depression that will be faced when pregnant with a new child, and this thing need to be wisely to control it. So next point is age at the time of pregnancy. So this is said because to conceive require sufficient maturity for women who want to pregnant. If she does not have a maturity, her mindset, this matter will be more harmful and difficult. So we can talk if the younger you are and the higher to you to get depression, postpartum depression, highly. So next point is number of children. So the large number of children is the cause of this, because when having a many children, the level of depression can increase if you cannot accept the noisy situation and the child own behavior. And for conclusion is family planning is most important thing for us to prioritize. So next is family history. Family history is relevant because in this world there are many types of family available and not all of us can accept our family situation, and this matter is not necessarily financially relevant, but it is influenced by the treatment of the family itself. So last point I can explain is marital conflict. Usually household problems can occur due to financial factor. For example, do not have enough finance that can negative impact the daily needs of a mothers who are pregnant, and in addition may also occur due to lack of understanding from our own partner, and this matter should exist tolerance between each other. So this is a little bit info I can share to all of you, and that's all from me. So thank you.
Assalamualaikum and good evening. My name is Muhammad Arif, and today I want to talk about how to treat postpartum depression. Treatment. Treatment and recovery time vary depending on severity of your depression and your individual needs. Next is if you have an underactive thyroid or underlying illness, a doctor may treat those conditions or refer to your appropriate specialist. Like allergic or ways to treat. Number one is psychotherapy. It will help to talk through your concern with a psychiatrist, psychologist, and other mental health professionals. Through therapy, you can find better ways to cope with your feelings and solve problems. Second thing is antidepressant. Your doctor may recommend an antidepressant if you're breastfeeding. Any medication you take will enter your breast milk. However, most antidepressants can be used during breastfeeding with a little risk of side effect. And that's all for today. Thank you.
Hi, I am Fadli Azian. Now, I want to share with you guys about how to prevent postpartum depression. But before that, I want to invite somebody that is expert about postpartum depression to explain more detail about it. Who is currently on the line? Mr. Adli. Hi, how are you, sir? Hi, I'm fine, thank you. Should we proceed to the main point, sir, about how to prevent postpartum depression? Absolutely. First of all, congratulations to the mothers that are having a new baby. They will be so exciting, and I hope it will be going well. But you have a valid of concern. It sounds like you have postpartum depression this time, and of course, you don't want to struggle with it again. I suggest first talking to your doctor because they can decide if there are medications that you can get on now that will help prevent it or at least dull a little bit and help you cope better. And if it still strike again, postpartum depression can happen anytime within the first year after having a baby. And in fact, studies and statistics shows that women who get to struggle most between 3 to 6 months after having their baby. So the good things is you have been through it before, and that make you knowledgeable about what the symptom and how you feel when you have it. And because of that, you can get help sooner and faster and hopefully prevent it from really get it out control or harder to manage as with any type of depression. One of the best things you can do is seek support and get a good support system from friends and family and also from medical professional if necessary. So keep watching yourself and don't be hesitant to ask for help. Obviously, if you ever struggle with thought of hurting yourself or baby, seek help immediately. That's a reason to go to the emergency room. But if you're just struggling a little bit with wanting to get out of bed in the morning, do the things you used to like doing. You notice just a change in your desire to do the things in life that you used to love may be obsessive compulsive disorder panic attack. All of those sort of things can be related to postpartum depression. Be sure to talk to your doctor. Thank you. Thanks to Mr. Adli, which starts a lot of sharing about how to prevent postpartum depression. And if any other question, please feel free to ask at Facebook page facebook.com/Healthdemic and recommend to your sister, brothers, friend and family. Thank you.